Dr. Steffes is going to be discussing sustainability, a secular or biblical concept. Some of his comments might surprise you a little bit. I was intrigued in reading his notes. He is not politically correct. But without further ado, Dr. Steffes.
Well, it's a pleasure to be here this morning. Thank you all for coming. I see also on our list of people who have joined us some old friends on there, so it's good to talk to you as well. This actually got started for me with a conversation that Dr. Dan Pinero started. He gave this lecture at the Louisville Global Health Missions Conference. And sitting there in the audience, as I am wont to do, I sat there and kind of started making, no, I don't agree with that, I don't agree with that, and I don't agree with that. And so we ended up actually with this presentation that the two of us put together was kind of a point and counterpoint situation, and it turns out that we're actually not very far apart at all. And so much of what started this whole thing, and certainly anything that's good in this presentation is Dan's material. Anything you can disagree with is fine, and I'm okay with that. There are two books that I would suggest to you that I think are worth your read. One is a book from Jonathan Bonk. It's been revised and expanded, and this is a gentleman who's looking at the whole problem of missions and money and how affluence affects what we do on mission field and so forth. And many times, I'm sure you've heard of situations in which a mission agency or a person goes there and, well, we'll just solve it by doing X, Y, or Z, and it's the first world solution to a third world problem, and you realize it all falls apart because there's no infrastructure. And one of the very first trips that I took to India with the Samaritans purse, we went to a field and someone had given them 10 brand new John Deere harvesters, $100,000 a crack. There was $1 million worth of machines out there, and not a single one of them was running because there was no way to get gasoline to that particular place reliably. So, a lot of times we come in with our idea of what the solution is without understanding what's going on. And so that book is worth reading. The other is a book by John Rowell, To Give or Not to Give, and he has looked very seriously at some of the topics that we're going to talk about today, and I'd recommend both of those books to you for a read. I don't know that necessarily you'll agree with everything that's in them, but they ask the right questions, and that's perhaps the most important thing that we can do this morning. Sustainability is a term that kind of goes up one side and down the other for me. I don't like it because it doesn't make any sense to me. Many politically correct words that we use in our language, we've changed the definition. We've changed the word tolerance, for example. Tolerance doesn't mean what tolerance used to mean. I tolerated something I didn't like. Now I don't dare say anything about it. That's tolerance. Sustainability is a word, from a political correctness standpoint, that has maintained its probably true meaning, but it doesn't apply. And that's my whole point that I'd like to discuss about today. If you don't look at sustainability or define it properly, then virtually everything that you do from that point on in various projects and so forth are altered by that altered definition, and that's what we're going to kind of talk about as well. I don't know if this is going to be 1 hour or 2 hours today. We've got enough material that perhaps if you guys chip in, and for those of you that are listening by the web, this is very much I want this to be interactive. So if you have questions, please interrupt, and we'll start there, and we'll just kind of go from there. But there's some things that I would like to address. I'm going to have 6 different theses that I would like to make some discussion about, and then if those theses are correct, we end up in different places than perhaps we would otherwise be correct. And so we're going to talk about, during this time, a definition of sustainability in terms of public health and charitable institutions. We're going to talk about the role of the concept of sustainability in that. We're going to talk a little bit about the challenges of sustainability. And we're going to hopefully emphasize the idea that there's a world of difference between stewardship and sustainability, that budgets are numbers, and they don't have emotional components to them unless we add emotional components to them. And a lot of times we make wrong decisions because we don't have good numbers, and the reason we didn't get good numbers is because we have all sorts of emotional things about what's acceptable and what's not acceptable, and we'll talk a little bit about that as well. And then we're going to talk about what parts of projects should be sustainable. if it's not financial, what things are required to be sustainable and for things to work. And so we're going to talk a little bit about the definitions of sustainability, and are we talking about in perpetuity? That's another whole story. There is almost no project that has lasted more than 50 years in evangelical missions. And so is that good? Is that bad? What is God trying to do with that? We'll touch on that. And then most importantly, we're going to try to look at the whole concept of what the only real truth in this world is what's coming out of God's Word. So let's look there and figure out what it should look like and how it should look. One of the issues, most of us don't do really well with budgets. We don't have a really good solid one for ourselves, for our own material. My mother is 83, and she's just decided she's going to go on a budget. Struggling with that, you know. Now, this is a woman who has squeezed a penny so hard she can copper plate a boat all her life, so I'm not sure what she's doing with this budget, but she's excited about that as well. But one of the problems that we have is if you go to your average mission conference, you may have somebody, everybody knows that there's really only 6 mission roles, right? There's pastors, and there's theologians, and there's physicians and nurses and airplane pilots and translators, and nobody else can really be a mission. Well, here in SP, we know that's not true, because the real reality is in many of these things, if we don't have an accountant, if we don't have somebody who can do the plumbing, if we don't have somebody who can do the IT, if we don't, you know, and so unfortunately, we often do not have the kind of people on the mission field or involved with certain projects that we should have. And first and foremost among those is an accountant. My wife's an accountant. When we go with Samaritans Purse, I sometimes don't get invited back, but she always gets invited back. They want what she does, and that's because a lot of times that just because I have been called to a mission field doesn't mean that God's given me skills in IT or in plumbing or in accounting. And we rarely see somebody come rushing forward to the altar at one of these conferences and say, I'm an accountant, the Lord's called me. But we all realize that that really is important. And so one of the problems then is that we often don't do accounting well, and the critical aspect of that is we therefore end up with numbers that really don't mean anything. And then we have consequences of those abnormal numbers. So one of the things that, for example, I've been pushing now for the last 15 years and haven't had much success is there's absolutely no group of organization support, et cetera, for hospital administrators or for hospital accountants on the mission field. So if Samaritan's Purse needs a new project, bringing together people that can actually help people do legitimate administrative decisions in terms of health care. Now, one of the problems is here in the United States, our health care has been so screwed up by Medicare and Medicaid that we often make all sorts of bad decisions from an accounting standpoint. And what you really need is someone who is an entrepreneur who understands that he's only got X amount of money, and at the end of the day, he can't spend more than that. But we need people to come on board and to help folks as we do this. So we have to have good accounting. One of the rules that I learned very early on is that if I'm losing money on every patient, I won't make it up in volume. And so if I don't understand how much something is costing me, I'm not going to be able to figure out what I should do. I was at one mission field, and it turns out that to take care of the average person sitting in the average bed, it was $5 a day. But they were only charging the patients $3 a day. What logic did they use, by the way? They can't afford it. They can't afford it. That's right. And so that's all well and good, but the reality is how much did it cost? $5 a day. So if you're going to make this argument that people can't afford it, that's okay and that's good and legitimate, but somebody has to pay the $2 a day. And this one particular person had come up with this whole project in which they were going to reach out to some underserved group, and I don't remember honestly what it was, but their whole project was based on $3 a day. And so they never did understand why I thought that was not a good idea, because they were losing money on a daily basis. They were struggling to make up the deficit they already had. And, well, we only charge $3. It only costs $3 a day. No, it doesn't. Your charge is $3 a day. It costs $5 a day. And so that whole reality, and then it got into, okay, then who should pay the $2? And then that's where we get into all the emotional, philosophical issues. One hospital that you guys support has a OBGYN who feels that, any woman should get free obstetrical care. And they have pediatrics who thinks every child should get free pediatric care. And you have every surgeon who thinks, well, the people who come in with life-threatening surgical disease need help. And the point is that everybody has their own philosophy about where the deficit should be made up and who should be paying for it and so forth. And, of course, I'm very good at letting your ox be gored, but please don't gore mine. And that's the issue that we get into when we don't understand this. So it's important. There's a person by the name of Leitner. Wonderful name. I'd hate to have been in kindergarten trying to spell that. But my sister, by the way, when she went to kindergarten, she says, my name is Cindy Stebbins, and I don't know how to spell it. So, Leitner, in the Evangelical Missions Quarterly in 2006, in October, has a great article about this whole issue, about how accounting is a science and how you use accounting. It has all sorts of philosophical, emotional, cultural, other issues in there. And it's a good article for a review on this. So my point is that a budget done properly is not good or bad. It's just a number. Now the question is how are you going to do that, and particularly in a charity hospital, to whom are you going to give charity? One of the classic examples is mission hospitals have to make a decision. Am I going to give free care to this tribe or that tribe or this people within 50 miles or women or children? Or, do I give the same discounts to somebody that drives up from the capital city in their Mercedes as I'm doing for the farmer who lives down the road who's barely making it go? Those are all philosophical, emotional decisions that get into this. And it's amazing how much your ego gets into those kinds of decisions. This other person must not be spiritual because he doesn't think that my people need help, And so this is a real issue that needs to be solved. Now, the other issue is that we often have to make sure that we're doing our cost accounting in a very rational, logical way. If I am doing surgery, the cost of that surgery is not just the suture I use or the anesthetic agent or the bandages. It also includes administration. It includes the guy who is giving me security at night. It involves the air conditioning at the pharmacy. And so on and so forth. A pill is not just what you buy the pill for. The pill is, okay, how do I handle the computer? How do I handle the distribution of that? How do I handle wastage? All those philosophical decisions. And those are, quite frankly, you can get true expert accountants in arguments over how best some of those things should be distributed. But the point is you need to know what they are, because unfortunately what we often do is we will look purely at I can buy this from this company at this amount, therefore I'm going to sell it at that amount. The answer is you'll lose money on a regular basis. That's one of the problems we have with hospital accounting the way it is here in the United States, because we cost shift so badly between Medicare and Medicaid and all the other things, we frankly don't know what hardly anything costs us. One of the things that I did in my former life was to run a surgery center. Since it was our money, we knew exactly what it cost us down to the penny, and so we could always compete a little bit better. And so in missions, it's not a matter of being able to compete as it is, I only have X amount of resources, and if I am a good steward, then I really need to do this properly. And so those are things that need to go into there. And why is that really important? I was in a hospital, again supported by Samaritans Purse a few years back, and they had a missionary who had very much bought into this concept that if we're really spiritual, we'll turn this hospital over to the nationals. The problem is that he wasn't counting depreciation. He wasn't counting the fact that all these missionaries are coming and working for free. He wasn't counting the fact that they were bringing supplies, that people were shipping stuff, that they had raised monies for the hospitals from the depreciation aspect and so forth. And the reality is, of course, is that their charges were really only about 1/3 to 1/2 of what it really cost to deliver care in that situation. What is interesting is that the nationals were smart enough to realize they didn't want the hospital because they knew that it cost all these other things. And he went away very frustrated and very discouraged because people weren't buying into his politically correct view that we must turn this over to the nationals at some arbitrary time. Classic example, I know that SB has been very much involved with Haiti. Well, you remember in the mid-1990s it became politically correct to hand over the hospitals, and so this denomination would hand it over and the other one couldn't be outdone, so they handed theirs out and so forth. And so what really happened is that as soon as they handed over these hospitals, they absolutely crashed because they hadn't done these things. And so that's really was the setting for when the earthquake and cholera and so forth, you had a lot of hospitals that no longer were functional because these principles had been forgotten. So what is the definition of sustainability? Can anybody here give me one that they like? When you hear that word sustainable, what do you think?
Something which just continues indefinitely. It just continues.
Okay.
Continuity.
And who pays for it?
The same people that were paying for it in the beginning are continuing to pay for it.
That's one definition. But usually when we talk about mission projects and we talk about sustainability, who are we going to say pays for it? Yeah, the locals, okay, of some sort. That somehow it's going to generate enough business profit, whatever, to actually make it happen. And so, one definition that I like for Mogadal, he wrote, the long-term ability to mobilize and allocate sufficient resources for the activities that meet the individual and public health needs. Now, obviously, that's a medical definition of sustainability and demands. And so when we talk about sustainability, one of the things is we have to be able to have an organization or an entity or a design that will respond to any external changes. So if something happens, there's a famine, there's a war, there's a whatever, that they can somehow adapt in order for it to be sustainable, because otherwise the next time they have a famine it falls apart, or the next time they have a war it falls apart, or if the inflation goes crazy it falls apart. So it's going to have to be an organization that has some degree of lightness on the feet so that it has the flexibility to change it. And of course that implies that you have the actual capability of paying for whatever those changes imply. So there has to be a culture that has enough redundancy in their money that if things change, they can actually respond to that. You obviously have to have an organization that has a demand for its services. In healthcare, that's pretty easy. They keep being born every day, so that makes it easier. And that obviously you have to have acceptable control over the resources that you use to actually do whatever it is you're doing. And so sustainability is much more than just, okay, for this week or this year, I made money, didn't make money, et cetera. It's the capability of going beyond that. And I'm going to add a little bit of sustainability argument beyond that, because that seems to imply that that's financial, okay? And it's not just financial. Or at least if you think about it more, there's a great deal more involved with it rather than just how much money do I have at the end of the year. So we don't want to confuse sustainability with stewardship. Kind of been forgetting my slides here, so let me see if I can move on here. We've mentioned this. What is the most critical thing I think on this slide at the very bottom is poor numbers, poor decisions. If you don't do it right, you don't know what it's costing you, you're going to make the wrong decisions. This is sometimes the way we handle it. This is from medical. And for those of you who can't read it, at the bottom it says, still no improvement? Nurse, attach more gizmos. And so a lot of times, if we don't understand what's wrong with the patient, we try to do other things. If we don't understand what's wrong with the organization, we try to do other things. That movement is confused with purposeful correction of what's wrong. Are Christian healthcare hospitals sustainable? We're going to get to that in just a minute. But the other factor that enters into this is that for us that are involved with charitable medical care, I always love it when people say, I would like to make this charitable hospital sustainable. What's the definition of charity? They can't afford it. How are you ever going to make it sustainable? Never going to happen. We'll get into some of that in a little bit. Even in the United States, we can't really do it. Charity, by definition, is giving the goods and services by definition to those who can't afford them. Now, if you are Mother Teresa and you are just basically wiping their brow and praying with them, those kind of services, we can sustain it as long as the person doing it has enough food, bread, and lodging to make that happen. But it's still, by definition, not really sustainable unless she or he gets some sort of money in response to that. And so I would argue that as a general rule, charity medical work can never be sustainable if your definition of sustainable is financial. There are other things in which it can be sustainable. From a financial standpoint, it probably doesn't. Let's look at the history. Anybody have any idea what year we had the most medical missionaries? Is it 2013? No.
1927?
1927. That's because I told him that yesterday. Not that he isn't brilliant, but in 1927, we had 1,265 medical missionaries, plus paraprofessional groups, but in terms of physicians and nurses. We have less than 1,200 right now. And of course, the world population has gone from 3 billion to 7 billion. Okay, there are less than 1,200 and some odd medical missionaries in the entire world, which is kind of bizarre. You in the World Medical Mission means that you know about half of them. Okay, and that's all there are. Okay, so that's a very serious spiritual issue that we can talk about. But what has really happened, of course, is that there's almost not a mission hospital left in Asia that functions as a mission hospital. Now, India still has some that are functioning as church-owned hospitals, but even there, you can see from up here, in 1947 there were approximately 400. There's down to 200 in 2003. We're aware that many of the big agencies, the International Mission Board with the Southern Baptists, SIM, now, in all fairness to SIM, they've actually done the reverse. They're starting to build their hospitals back up, but they had started to get rid of them for a long time. Now that the International Director is a physician, there seems to be a change in priority there. But many of the big agencies, the Presbyterian groups, the evangelical Lutherans, any of the groups that had mission agencies have basically, that had multiple mission agencies, have divested themselves of those. There's not many left. As a matter of fact, if you go through the list of hospitals that you guys work with, it's almost always just one institution for one facility, okay? In terms of people just building one hospital in Sudan or one hospital here, there's not the kind of the big organized groups anymore. Christian and Missionary Alliance, who used to have several mission hospitals, they got down, 10 years ago, they were down to exactly one in Gabon. They recently have started the clinic in Guinea that is coming up to a hospital. In Kenya, there's a Christian Healthcare Association of Kenya called CHOC, and in their statistics, only about 10% of mission hospitals are actually doing well. So this is a real issue. Now, what is important to realize is that God hasn't changed. He's still Jehovah Rapha. He's still the God who heals. I think Christ, who created all of the universe, is terribly offended by the effect of sin in our lives. He is the great physician. I think he gets up every day, if God can be said to get up, and is offended by what he sees. And so I think, this reaching out, the healing that he's trying to bring is not only spiritual, but was clearly physical on earth when he did that. What's happened to many of these Christian health institutions is that they've lost the vision. We had an interesting discussion within PAX in the last week about the idea, is institutional drift inevitable? In other words, can you think of any Christian institution that is persistent for any length of time? How about our great Christian institutions like Harvard and Yale? And, we can go on for Brown University and Duke University, and, we can go on forever, and virtually all of them have lost that. Virtually all of the mission hospitals in Asia have lost the focus. It's become care, but not care of the soul and spirit in addition to that. What has happened in many places is that we've had this kind of paternalistic or politically correct or colonialistic or whatever kind of attitude that when we're not there, they can't function, and so we've turned the hospitals over, or we've made bad decisions from the institutional standpoint, and now they're no longer functioning. That's all over this world. And yet, on the other hand, we have an entitlement mentality that is there as well in many of the groups that we work with. So that's an issue as well. One of the biggest problems that we have is that we have gotten very tired of the process that it takes. Many of us have an idea. In your church, I'd like you to go this weekend, and I'd like you to ask them for support for a mission project that you're enthused about, and ask them to commit for 60 years. The answer is 3 years, 5 years, we'll look at it again if it isn't happening. So we've created this really artificially short horizon, and then we've tried to enforce that with our budgets. And so, you've only got 5 years to make this, quote, sustainable. And many of these projects can't be made sustainable ever, but if they can, it's not 5 years, 10 years. It's artificially shortened as well. So that's part of our problem. The other issue is that because we're responding to that pressure, what I have seen repetitively is that the missionaries will train one set of people for particular jobs, and then they say, well, I've done my job, it's not sustainable, and I leave, and now that person runs for this office or goes here or gets bid for this NGO or someplace or another, and all of a sudden the entire place is falling apart because we have never taught them to train their replacements or to come up with a system that really works for them. And of course, the other real issue that comes along here is that we get weary in well-doing. What do you mean I've got to pay for 60 years? What do you mean I've got to pray for somebody for 60 years, If they're any good, they're spiritual, in 6 months it's going to be solved, and I'm going to get somebody else. How many times have you seen people, and maybe you have been involved with churches in which somebody has a ministry perhaps to Islam. I know one particular mission hospital that in 18 years of service, they have one conversion that they are sure of, okay? In many churches, their funding would have been cut because clearly they're not spiritual enough. And so this mentality about what's sustainable, not sustainable, how we measure it, is really, really very critical. I wanted to look briefly at the whole issue of administration. Again, a lot of times we'll recruit physicians, but we don't recruit administrators. And that, I would tell you, is a mistake. The Chalk study in 1999, they looked at several mission hospitals, 15 mission hospitals, and in theirs, 10% of them were considered to be doing well, 50% were considered to be, don't know about tomorrow, and that 40% were doing poorly. So let's look at this and figure out what they're doing and why that makes a difference. Because obviously, if you can't administer the project, sustainability is not a possibility. If it can't be properly administered, it's not going to happen. In that top 10%, almost all those hospitals had figured out a way to be sustainable on patient fees. Now, we're going to talk about that. That's not always good. We'll talk about that as we get into it. But these hospitals were able to maintain most of their costs by sustainability. In other words, they weren't having to beg other places. They were responsive to the marketplace. People in the community obviously thought their services were reasonably priced. They could come up with enough money, however they got that money, and make it happen. This is always good if you want to be sustainable. Your income is more than your expenditure, okay? And the real reality is you're controlling your expenses carefully. You're looking at things. The staff was less than 50% of their budget, okay, so it wasn't overstaffed, and again, that can be problematic. I was on staff at Malago University in Kampala, and at night on the surgery ward, we had one nurse for 100 patients. Yeah, well, they were controlling their costs okay, but there were some other things that didn't happen. As a matter of fact, they did a study at that particular hospital that the one factor that correlated most closely with whether you survived your hospitalization was whether somebody was with you, because they could go down and beat on the door until the nurse answered. Okay, that was the answer. And of course, again, they have more and more patients coming to it, so they're healthy hospitals. They had a business-oriented management plan. In other words, they literally were looking critically at their whole process. This was, we have committees, we have experts doing the right thing, we let experts make decisions about their areas of expertise, et cetera. So they had a strategic plan. They had technocrats, they had government officials, etc. They had a really formalized, open management structure. If there was a crisis coming, they responded to it, trying to cut it off rather than to wait until it festered and abscessed. They were flexible. They were thinking about new ideas, new ways of doing things, and they looked at private sectors, even though these were mission hospitals, and said, okay, if it's working in there, that's best business practice. How can I make that work in my environment and make sense out of that? Many of the mission hospitals that you guys are familiar with don't run that way. We tend to really think it's wonderful because we know missionary X who stayed at some place for 28 years and he ran the whole thing by himself. Isn't that wonderful? None of those hospitals are surviving after that person left. Okay? And so, unfortunately, a more traditional thing is that we often will have a spiritual leader. And in Africa, which I'm most familiar with, sometimes that's within the church. And so you'll have the pastor making the medical decisions, making these decisions about cost assignments and spending large amounts of money and all sorts of issues that they don't know anything about. To give you a sense of that, any of you have had kids in Christian schools run by a pastor, okay? They don't know anything about education, and they often don't know anything about counting either, which is another whole issue. But these kinds of situations end up that you'll have a lay manager who is not very qualified. As a matter of fact, his qualification often is, I get along with the one guy who's in charge. That's his qualification. And when they look at these hospitals, almost all of them don't give either good medicine and don't give good business principles with that as well. Now, there are some exceptions to that, and frankly, don't take what I'm saying as highly critical of those folks, because if you're by yourself and that's the best you can do, God bless you. But that's not the same thing as actually having it done well, and those are different issues. And then the ever-popular dysfunctional management style, which means nothing works, and that's usually the one person who's the dictator, who you can't get the decision made until that person gets back. He makes it depending on whether or not he had a good night's sleep, that decision versus you've annoyed me today, or I don't like the color of your tie, or you're wearing a pink shirt, or whatever kind of thing that might come into that. So the top performers in this, if you looked at it, they had the business-oriented management style. The medium ones had a kind of a more traditional management style, and the dysfunctional ones, obviously, were dysfunctional. Let's go to thesis number 2. Now, that's taken us 37 minutes to start my discussion here. Okay? So I think we're going to a second time sometime in the future. Christians often engage in magical thinking. Okay? Now, I'm going to be politically correct and incorrect here. Do you realize that over 3/4 of the market for multivitamins and food supplements are to evangelical Christians? Okay? We get kind of this philosophical, magical thinking that God is going to do things in weird and wonderful ways. If I take the audience in your church on Sunday and you give me the opportunity and I lay it out properly, at the end of 30 minutes, I can have everybody agreeing that we ought to give free care to these poor folks. That, if we were really Christian and so forth, we would give free care to that. On the other hand, if you give me the 30 minutes and I come from the right presentation, at the end of that 30 minutes, you will be convinced that, well, of course we shouldn't keep spending money for all the rest of their life, and they should be 100% sustainable, because that's right there in the Bible, somewhere in either Hezekiah or 2 Condominiums. Okay? So we get this magical thinking. If you go there and charge, and we see this with short-termers all the time, how dare you charge these poor folks? Well, what happens if you have $10 and you spend it today? You don't have it tomorrow. You're done. We're finished. Okay? And so clearly free care has all sorts of other issues that go along with it in terms of they don't value it. They often don't follow your directions. There's lots of reasons why free care is not a good idea. There's a reason that it's popular amongst all the people who are trying to take over a country. I'm going to give everybody free care. But there's no such thing as free medical care. It doesn't ever exist. And yet, at the other hand, we have this idea that we need to be sustainable. There's no way you can be sustainable if you're giving it all away, unless you have an infinite amount of money. So these concepts, which sound good, are neither biblical or inherently spiritual. Okay? The existence of both is clearly impossible. You can't be A and not A at the same time. One of the things that I see quite frequently is when I feel that there's a project that I really want to do and the budgets don't quite match, if you question me about it, what will my response be? You just don't have the faith. Okay? If you had faith, this wouldn't happen. Okay? Because I have faith. Okay? Faith does not trump planning. We know in the Old Testament we have this, in the New Testament, which of you would build a tower without looking at the cost? There's two risks that go on with this whole idea of planning. Analysis and planning and logic and thought are not antithetical to faith. They're part of it, in my opinion. But what is also true is that wishful thinking, well, I'm going to go there and somehow God's going to provide, that isn't inherently spiritual, and it isn't change reality. Now, where does faith comes in? I think faith comes in when I have done all my planning, and I'm convinced God wants me to do it. And so the answer is, that's where my faith comes in. But I've already done my planning. I've done the best I can. I figured out where I'm going to go. I'm going to know where to work. I'm leaving plenty of room for God. PAX is like that. We don't have a single dedicated donor. So I just sat down for this coming year, and I just came up with a $795,000 budget. And it's infinitely well planned, in my opinion. It's phenomenal. I mean, I know what they're going to spend at this and so forth. But what I don't know is where the first dollar is coming from. Okay? Now, what I do have is in the past that God has responded to that. He's clearly making this happen. Anything that's happened in PAX is not my responsibility. It's not the missionaries. It's not the commission. It's God's project, and for Him to be the glory. But it's not a matter of where faith isn't important or that planning isn't important. They're both required. But I think sometimes people get lazy and try to throw faith in where planning needs to be involved with this. Now, there is the risk of the other, and I've seen this. Well, I don't know where any of this money is coming from, therefore let's not do anything until God provides it. Okay? And so then it becomes an absolute gridlock in your thinking because you can't go forth without the faith. And the reality is, of course, is that if I have the money, where's my faith in that? Faith is by definition the substance of things hoped for. And so, there is some sort of magical, spiritually correct, in the middle road there. I'm not always sure I know. And of course, if I'm in one direction, you're obviously too far in the other direction. So that goes on with it as well. Is sustainable project good? The definition of sustainable, as we've used it, is a financial decision. In other words, at the end of the year, I've made money. It was a good business plan. Is that a God thing? One of the things that Blackaby makes a big point is that, we're supposed to go see what God is doing and join Him. If we're doing it in our own power, it's not a God thing. It's a good thing, okay? But it's not a God thing with this. And, if I run a business, I go out and start a business and I make money off it, did that make it godly? No, it made it a good business plan, but it isn't necessarily a God thing. And so I think what is very true in that situation is that when I don't need God because my business plan is working, really hard to give Him the credit, and certainly hard to be dependent on Him, and certainly hard to exercise my faith because I'm doing a business thing. I'm not doing a God thing, a faith-based thing. So where that fits in is not clear. I'm going to have one more thing that we're going to start on and we'll continue on next time. Having said all that, I think sustainability has a role in missions. But what is the role of sustainability? Take it out of the financial situation. What should be sustainable about a project?
Long-lasting.
It should have long-lasting effect. Okay, what else?
Knowledge transfer.
There should be knowledge transfer, should be reproducible or at least self-propagating. Okay? What else? What about the purpose? I mean, the purpose has got to keep going. And so one of the things that we have to understand is that, for example, I was talking to Kenny Isaacs yesterday about this, and he was going off on a diatribe, and I actually agreed with him, and which I often do. And he was making the point that we are not called at Samaritan's Purse to be an international relief agency. Oh, wait a minute. I thought we are an international relief agency. We're not called to bring water to the desert. We're not called to bring short-term missionaries to help out long-term missionaries. We're not called to bring equipment to hospitals that need equipment. What are we called to do? To bring the gospel, to bring honor and God glory. Now, we do it through all these mechanisms. But the minute that that main vision, main purpose, main center is no longer part of the process, then we end up with Harvard, Duke, Yale, and all these other institutions because we've lost that focus. And so sometimes we forget what our real focus needs to be and should be. And sometimes we get so focused on my project that it's hard to remember what the project is. You've all heard that story of the people doing the carving on the cathedral, and the guy says, "What are you doing?" He says, "I'm sweeping up the marble dust." And he says to another guy, "Well, what are you doing?" He says, "Well, I'm actually working on this gargoyle that's going to go over that door." And the one guy says, "Well, what are you doing?" He says, "Well, I'm working on putting the roof on this cathedral." And the other one says, "What are you doing?" He says, "I'm building a structure that's going to bring honor and glory to God." Okay? Different motivations, different ways of doing things. Your tolerance of what doesn't go well changes with those kinds of situations. So I think it's very important to realize that our sustainability is a project which has the right vision at the very beginning. And then we've talked about the other things. It's got to be sustainable, self-propagating to whatever extent. Now, one of the issues is that there really aren't many institutions that have lasted over the centuries. The Catholic Church being one of the few exceptions I can think of. And anybody who's honest about this, they've wandered in various directions. But virtually no other institutions have stayed that way. YMCA, we just took the C out of YMCA. All these organizations that have gone away. We often become politically correct. There's the Agency of Christian Relief Agencies, and if you look at it, they're changing their statement now to go to more politically correct statements rather than biblically based statements. And those kind of things happen on a regular basis. What is very, very true then is what is sustainability? And what we're going to discuss in the future is how can we make these projects sustainable? What does that take? Does God want sustainability? Does he want independence? We as Americans, North Americans, independence is one of our big deals. The individual. Who are our great stories? Boone, who wanders off into the desert, or off into the thing. There are people that go off and do things by themselves. You tell those stories to my African friends, and they look at you. Why would you want to do that? It doesn't make any sense to them. And so we have this emphasis in our society about I've got to be independent. I've got to pay for it myself. I've got to be powerful. We were talking about this with physicians. Physicians hate the idea of having to actually take money from anybody to go on mission fields on things, And the reality is, of course, is that they can raise money faster than anybody else because people are so surprised that those greedy fellows are going to go do something good that they'll it's actually pretty easy. But we have this idea of independence. I don't want to bother God. Yeah, I'm sure I'm the biggest issue in his problem today, that I'm going to bother him. The other thing that this brings into, and we'll talk about this a little bit more in the future, is that with self-propagation and so forth, with partnerships with teams, this isn't a 5-year program. This is often a 20 or 30 or a 50 or a 60-year program in order to really make this happen and do it properly. And then you get into the decisions. Okay, who makes the decisions? Who decides when I turn this over? Who decides? Now, it's kind of like my 16-year-old kid. When I had a brand new car, he was really convinced he could drive it. Okay, I was less certain. You get into these whole legitimate questions about who should handle the turnover? Who should, what parameters should be reached? How do we do this? What it shouldn't be is, it's July, let's turn it over. There's a lot of reasons why they want it turned over. There's a lot of reasons why we want to turn it over. That doesn't always mean it's the right thing to turn it over. So we're going to go on to some of these other things a little bit further. We're going to talk about sustainability and perpetuity. Does something that starts, do you have to have it forever? Okay. Just because it's your good idea, does that mean it lasts forever? There's not much in our history that suggests that we can actually pull that off, but we often have that idea. We're going to talk about the fact that sustainability is not possible in the United States either. Okay? And so then what does that mean from a scriptural standpoint? How do we handle things and where do we go from there? Thank you for your time. Open to questions. You didn't interrupt me much, so this is your time for questions and ideas. And I would like you to at least, as you think about this over the next few weeks, write some ideas. Well, what about this? Or we have this situation. How should this be handled? I'm not sure that I know the answers, but we'll at least try to define what the questions are behind those questions and see if we can answer them.
I should have said at the beginning that this is a two-part series. Part 2 to be in sometime in August. I was just going to emphasize one of your most salient points is what is your in looking at sustainability, what is your purpose? And I'm reading that book when Helping Hurts. One of the points they bring up is comparing project oriented versus process oriented, and a lot of projects we're involved in, if they're more process oriented, they tend to be more sustainable. And specifically, I think when we really inject in the process that it's our Christianity, and that all these projects that we're involved with, that it's for, as you said, it's to deliver the gospel. And a lot of times it's very easy to lose that focus. I know a lot of times I've been out in the field and I've gotten so caught up in what I'm doing in delivering health care, I get home from my mission and it dawns on me, I hardly shared my faith, and it's devastating to me, and I think it's a lot less effective. So we really need to remind ourselves what is our purpose, and in delivering health care or whatever you're providing for them, it's important to the process and to deliver your faith. I think it's a lot more sustainable when we do that. And that's our primary objective as Christians.
I do want to clarify a couple of things. What I've been talking about, we've been talking about primarily healthcare delivery. If you are doing micro-enterprise, and that is your ministry, then obviously micro-enterprise, based on business principles, has to be sustainable, or it's not a business, okay? And so that's important. It also is important to realize that in church planting, which often require a great deal fewer numbers of resources and so forth, you can make many of those projects using national evangelists and so forth. You can make those things much more sustainable, much quicker. Of course, the real reality is that you can make them sustainable only in a small area as a general rule, because if you look at the great nature of what the need is in the world, you can always go from this place to the next place and continue on, your vision of what you're doing. But so it's not that there isn't a role for sustainability. It's just that often in medicine, we take what is a business principle and try to apply it to what is a charitable principle, and you can't do that. It doesn't work in any meaningful way. Now, having said that, there are some programs, for example, I know of one in Tanzania where they have created an industry. They had enough business people who came in that they took the profit from the business to pay for the health care. And so, they're saying that's sustainable. Well, what it's telling you is the business is sustainable and the health care is still not sustainable. So I would argue a little bit about the definition of that, but I'm thrilled that they're able to make that happen. Of course, the real reality is what makes our charitable hospitals in the United States sustainable? Where does the money come from?
The government. The
government's a big chunk of it. Donations, the individuals. And so that only happens from traditionally the middle class. And so if you're going to, because they're the ones who are going to pay the taxes, no matter what Obama wants to change. And they're going to be the one who are going to give most of the donations. Matter of fact, the lower middle class actually give a higher percentage than anybody else. If you don't have a middle class in that country, sustainability is almost never going to happen until that actually occurs. And then it's not sustainable. It just means that it's sustainable within the country as opposed to requiring extra-national support, et cetera. The other point that I'd like to make is that by definition, some projects are not meant to be sustainable. 90% of what Samaritans Purse does is not meant to be sustainable. It's meant to be a reaction to a great need. Okay? And so don't let them come in and confuse you. What happens here where it gets confusion is that we come in, we respond to an acute phenomena, and then we stay around for 6, 8, or 10 years, and now all of a sudden we're talking about development, and then all of a sudden we're talking about, now that's got to be sustainable. Whether it can be or can't be is another question. But, we often get those confused, and then we'll say, well, gee, what we do isn't sustainable. Well, no. By definition, it's not. And so I'm talking about sustainability here in projects that should be, that we have a long horizon. A project which is short horizon, by definition, is never going to be sustainable. Okay. You're not going to make enough money going to victims of hurricanes to make this work. Okay.
Dr. Steffes, can you think of an instance where a mission hospital has in fact been turned over to nationals and it actually worked? And if there isn't an example that you can think of, do you think that could ever really become a reality, taking into consideration the cultural aspect of the environment that most of these mission hospitals are operating in?
No, is the answer. Is the short answer. The problem we have is you get into the definition of working. Okay, what is happened in virtually all the mission hospitals that I have visited is that the quality of care goes down. Now, they may reach an equilibrium in which they can afford to give and make it work at a lower quality of care, but that isn't the same thing as where the hospital was relatively before. The hospitals that work best that have been turned over still have a significant missionary component. Okay, and they may be owned by the Wachijigi Church or, this denomination. There are some who come closer than others. But, I can get into a lot of trouble saying that, but the answer is no. It at least is not, they're not apples and apples. They're apples and kumquats or something that have been changed. Now, there's some countries and some peoples that are just doing a phenomenal job given their limitations. And I admire that. But it has never been really transferred easily. And part of the problem, and we'll get into this with that, is then we need to let them just give the care that they can afford. There's an implied superiority or racism or whatever the right word is in that bothers me. I demand a level of care for my family members, but it's okay if that lady loses her child because she can't afford it. I have problems with that, and I don't know the solution. I don't, the poor you're always going to have with you, but I'm bothered by that. And of course, that's exactly what Paul Farmer is pushing so much in his stuff now. He is trying to take all the money from Boston and move it down to Haiti, and his plan is not sustainable under any circumstances. His passion is admirable. His amount of effort that he goes into it, his awareness is admirable. We can't do that either. It's one of those things that in all the mission work, if you're not uncomfortable by the end of the day, you haven't been paying attention. Okay, there's too much out there. There's too many people dying. There's too many people hurting. There's too many people not knowing the Lord. That if that doesn't bother you, you're not paying attention. But having said that, I've not seen a good the Emmanuel system in India that is running dozens of hospitals are doing it at a reasonably acceptable level, and they've got some really high-trained people. But they're developing a middle class to help pay for that. But most of their hospitals don't run at the level that they once did. Although again, some of them are outstanding. So it's a little questionable, but it's a small percentage if there is some. And then that asks the questions, and then finally, how long do I have to pay for it? And that's one of the things that we'll talk about next time.
Any other questions? Or closing moments here? Now's your chance.
Hey, Bruce, thanks a lot. This is Mary Lou. How are you?
Well, Mary Lou.
Just one comment. You had talked about administration. It seems like one thing medical missionaries could do in addition to being doctors and nurses and other providers is to do a whole lot more toward teaching administrative and managerial skills. In the countries I've been in, it just seems like that's one extremely poor part of it. These folks don't know how, they don't have management techniques, they don't know how to run hospitals, they don't have business plans, they've never been taught that, and it seems like maybe the mission community could do more toward being a part of helping to boost up that part of it when it comes to particular MOH people and hospitals and health centers and all sorts of facilities. So that's my comment.
Yeah, there's no doubt about that. And again, I've been trying to get people to put together a group similar to PACS to kind of help do that without much success. Having said that, if you look at the PRIME study that came out at the CMDE conference, missionary physicians spend already 40 to 60% of their life doing stuff that doesn't have anything to do with medicine. And so, in a world where there is this huge number of needs, the reality is not to ask, I think, the missionary nurses and physicians to do this, but for the rest of the world to come alongside with their set of skills and make sure that these things happen. Anyone else?
In the last several years, I've heard more and more this movement or idea of BAM, business as mission. Do you know if that has any intersections in the healthcare sector that you know, or is that?
The question is has there been any intersection between business as missions and the healthcare sector? The answer is not really. I haven't seen a whole lot of impact with that. What is very real is that the nice thing about being a medical provider is I can get in any country in the world. And so it's actually one of more than the business folks can. And so, one of the things, it's an extraordinarily important way for creative access missions. But it has a true hybrid between the two has never really been particularly effective that I've seen yet. There might be something out there. I'd love to hear about it if it is. Probably the closest would be this Tanzania hospital that I mentioned that has the industry next to it.
Okay. I'd like to thank you very much, Bruce, for speaking to us today about sustainability.